Most men never question how they urinate. It is a deeply ingrained habit developed early in life, shaped by culture, upbringing, and social norms. Yet from a medical perspective, urination is a remarkably complex physiological process. One that is significantly influenced by posture, muscle coordination, nerve signaling, and pressure dynamics. This comprehensive guide explores the science behind urination posture and provides a detailed, evidence-based comparison between standing and sitting, helping men make informed decisions about their urological health. Section 1. Anatomy and physiology of urination. The urinary system includes the kidneys, ureters, bladder, and urethra. The bladder is a hollow, muscular organ that stores urine and gradually expands as it fills. When it reaches functional capacity, typically between 300 and 500 milliliters, stretch receptors embedded in the bladder wall send signals through the nervous system to the brain, triggering the urge to urinate. During the act of urination, 3 coordinated events occur simultaneously. The detrusor muscle contracts to compress the bladder, while both the internal and external urethral sphincters relax to allow urine to flow. This entire process depends on precise pelvic floor muscle relaxation and adequate abdominal pressure to ensure complete and efficient voiding. Any disruption to this coordination, including those caused by poor posture, can compromise the efficiency of this process. Section 2. The importance of posture. Posture directly affects multiple aspects of urination, including pelvic muscle relaxation, the angle of the bladder relative to the urethra, abdominal pressure distribution, and urethral resistance. Even subtle changes in body position can significantly alter how efficiently the bladder empties. The orientation of the pelvis determines how much tension remains in the pelvic floor muscles during voiding, and this tension directly influences the speed and completeness of urine flow. Section 3. Standing position, a detailed analysis. Standing is the most common urination posture for men across most cultures worldwide. It offers clear practical advantages. It is quick and convenient, and is well suited to public restroom environments. However, from a strictly physiological standpoint, standing has notable limitations. When standing, the pelvic floor muscles remain in a state of partial tension. This residual tension compresses the urethra slightly, increasing urethral resistance and reducing the efficiency of bladder emptying. As a result, men who urinate exclusively while standing tend to retain a greater volume of residual urine after voiding. Over time, consistent incomplete emptying may contribute to the development of urinary symptoms, including urinary tract infections, bladder irritation, and a reduced functional bladder capacity. Section 4. Sitting position, a detailed analysis. Sitting promotes a natural, fuller relaxation of the pelvic floor muscles. When seated, the body assumes a posture that reduces tension around the urethra and optimizes the bladder-urethral angle for drainage. Research has demonstrated several measurable benefits of sitting. Improved bladder emptying with lower residual urine volume, stronger and more sustained urine flow as measured by uroflowmetry, reduced post-void dribbling. A common and embarrassing complaint, greater comfort for men who experience urinary hesitancy or straining. For healthy young men, the difference between positions is minimal. However, for men experiencing any lower urinary tract symptoms, sitting provides a clinically meaningful improvement in voiding efficiency. Section 5. Scientific evidence. Multiple peer-reviewed studies have examined the relationship between urination posture and urodynamic outcomes. A landmark meta-analysis found that while healthy men show only marginal differences between positions, men diagnosed with lower urinary tract symptoms, particularly those associated with benign prostatic hyperplasia, benefit substantially from adopting a seated posture. Key findings include reduced post-void residual urine, improved maximum urine flow rate, and shorter total voiding time when sitting. Section 6. Prostate health and aging. The prostate gland surrounds the urethra at the base of the bladder. With advancing age, benign prostatic hyperplasia, BPH, causes the prostate to enlarge and compress the urethra, obstructing urine flow. Sitting reduces direct pressure on the compressed urethra and creates a more favorable anatomical alignment for voiding. For men over 50, adopting a seated posture can meaningfully reduce the strain of urination and slow the progression of associated symptoms. Section 7. Lower urinary tract symptoms. Lower urinary tract symptoms, LUTs, affect a significant proportion of men, particularly after middle age. Common symptoms include a weak or interrupted urine stream, urinary hesitancy at the start of voiding, the sensation of incomplete bladder emptying, and post-void dribbling. The seated position consistently outperforms standing in managing these symptoms, offering a simple, non-pharmacological intervention that requires no cost. Section 8. Behavioral and psychological factors. Changing a deeply habitual behavior is never simple. Urination posture is influenced by early childhood training, cultural expectations, peer behavior, and personal comfort. Many men associate sitting with weakness or femininity, a perception reinforced by social norms rather than medical evidence. Overcoming this barrier requires awareness, education, and a willingness to prioritize health over social conditioning. Section 9. Hygiene considerations. Standing urination inherently generates a small but significant amount of aerosol spray, which can contaminate surrounding surfaces, walls, and floors. This contributes to bathroom odor and the spread of bacteria. Sitting eliminates this issue almost entirely, resulting in cleaner bathroom environments, a benefit relevant both at home and in shared spaces. Section 10. Special populations. Certain groups of men stand to benefit most from adopting a seated urination posture. Men over the age of 40 experiencing early urinary changes, patients diagnosed with benign prostatic hyperplasia, individuals recovering from prostate surgery or other urological procedures, and men with neurogenic bladder conditions. For these individuals, seated urination is not merely a preference, it is a clinically recommended practice. Section 11. Long-term health implications. Consistently incomplete bladder emptying carries long-term risks that extend beyond mild discomfort. Residual urine creates a hospitable environment for bacterial growth, increasing the risk of recurrent urinary tract infections. Over time, chronic bladder dysfunction can develop, and elevated back pressure may affect kidney function. These consequences are preventable with simple, proactive changes to urination habits. Section 12. Practical daily recommendations. Regardless of which position you choose, these principles improve urination quality and long-term outcomes. Take your time. Never rush the voiding process. Relax your pelvic floor consciously before initiating urination. Avoid straining. Forced voiding increases bladder pressure unnecessarily. Ensure complete emptying by waiting a moment after flow stops. Stay hydrated. Adequate fluid intake maintains bladder health. Morning urination benefits from a relaxed, seated approach when possible. Daytime voiding should not be rushed. Nighttime urination is best kept calm and unstrained to avoid disrupting sleep. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.